Have you thought about or heard anything about resistance or treatment of resistance? Do you see that often in your practice? And did you hear anything interesting at the conference regarding that?
Yeah, this is the thing. Hormone receptor breast cancer. There is a good talk. All these most of the talks are about hormone resistance and what we do. Whether we do doublet therapy, we give two different drugs or three different drugs
Hmm.
to overcome this, and they're targeting at different levels. And then we are having biomarkers. We have specific tests to do those tests and then target these cancers with those specific treatments.
Hmm.
So it's become very targeted, very precise.
Yeah.
Yeah, going back to the Destiny 05, it's not no chemotherapy at all, but less chemotherapy. And so hopefully that will become the standard of practice.
Mm-hmm. Were there any other papers or presentations that you were excited about? I know you talked about the first ones in the beginning, but was there?
There was one thing called positive trial. Okay, it's looking at avoiding or breaking hormone treatment for this younger woman who wants to become pregnant. So, the fact that you have breast cancer or any cancer shouldn't deter you from having normal life, especially if they picked up early. So I have this, it's a difficult conversation with the patients. They had the treatment now and they know, yes, this is never going to recur. Now the reality hits. Okay, I want to have children. What should I do? I'm on hormone treatment for
Mm-hmm.
X number of years. What shall I do? So actually, there's some evidence to say if you have 2 years and then stop, then you do gain benefit, and then I'll ask them to say, look, go and have your IVF or whatever treatments, or try for a pregnancy naturally, and then an assisted pregnancy, and then come back and restart. So that is what the positive looked at,
Mm-hmm.
and then it's really good. I can there's some evidence base for this, and I can quote the figures and say you do need to restart, but it is reassuring that you can go back and try and have good quality of life or have children, which is probably what we wanted, because as we are, I think with all this modern life, we women are delaying having children later and later and later, and then when you are in the late 30s or early 40s, and that's when you think, oh, I want to have children, and you hit with this cancer diagnosis, it actually changes your whole world, isn't it? So things that actually thought well, the drugs are good, but I think it's about more about a rounded approach, to cancer and treatment, because these patients need uh, to have children, and that's what the positive trial says. Yes, you can interrupt treatment. They can have the treatment, IVF, and it was really positive. Most of them had, whether assisted or natural, they had children, which is really good. So that was, that is, I think for me, is quite interesting.
That's fascinating.